Hello, my name is Dr. Paola Granados Radlick, and I am a licensed clinical psychologist specializing in children, adolescents, and young adults. I typically work with individuals who are struggling with anxiety, depression, bipolar disorder, and a myriad of other difficulties, including things like feeling like you're really emotionally sensitive and struggle with managing your emotions, which may lead to some behavioral difficulties, acting out behaviors, issues with relationships, being able to make friends, keep friends, or even in romantic relationships, feeling like they're really sometimes extreme and they become problematic. So today what I'm going to be doing is just really briefly going over sort of what my practice is like, and for you to be able to get a better understanding of sort of how I do things. So I know that choosing a therapist can be really challenging, especially with how many people are out there, and resources can be really difficult to find. So hopefully by the end of this video, you'll be able to have a better idea of whether you'd like to reach out to me or not. So how I do things typically is really quite collaborative. The idea is that you are the expert in you. You're coming in with all this raw information from your life and your experiences. And on my end, the hope is that I will be bringing all my learning, my experience, to be able to provide you with some support, some new skills, an experience where we'll be really exploring together sort of what is going on for you. So I typically begin with a few weeks of really evaluating what is going on for you and getting to learn a little bit about each other. After a couple weeks, 5 to 6 weeks, I'd say, we really determine together if you feel like that this is still a good fit, if you're feeling like working with me is gonna be the right fit for you, and if not, then I'm happy to refer out and we'll go from there. If you are willing to or wanting to continue working with me, then what we're going to be doing is really exploring sort of how your thoughts, behaviors, emotions sort of are coming about, and being able to really determine what is getting in the way of you functioning effectively in your life. And the idea is that by coming to therapy, that you're going to be able to build a life that is meaningful, and that's going to be really particular to you. And so I provide individual therapy, like I said, for children, adolescents, and young adults. I also offer therapy for parents to help guide them during these times of quite a bit of changes with their children. If they're worried and they're concerned and they just need consultation, that's another thing that I do. So my job is to really help you organize this information that you're bringing into therapy and teach you new skills to be able to come out on the other end with a new idea of how to cope more effectively. So when working with children, parents often ask me just how involved do I need to be in therapy? And my answer is, especially if your child is quite young, so just probably 3 to like 8 or 9 up to like age 12, I would say your involvement is going to be greater than if we were working with an adolescent, because the idea is that you're taking everything that we are learning in therapy and also implementing it in the home and potentially even teaching it to your child's school or other therapists that may be involved, or other family members or caretakers, so that the effects of treatment are really pretty widespread and that we're seeing greater benefits. However, when working with adolescents, for example, your involvement as a parent is probably going to be much less, given that developmentally they want a bit more privacy, understandably, and this can be concerning for some parents coming in. So what I can say to that is that obviously, should any concerns come up regarding adolescent behavior that is not typical for them developmentally, or it's very different from what they were doing before and they're engaging in, risk-taking behaviors that weren't present before, I would encourage the adolescent. We would maybe bring you in and have them share this information with you so that you are aware of what is happening. So as you can probably tell by now, so this process is really collaborative. The hope is that you're going to be able to really explore in session that you're finding that the space here is safe. It's a place where you can come in and share your difficulties and your concerns. And to be honest, sometimes it can be really challenging to do this work. So I really emphasize a strong therapeutic relationship so that you feel like you can confide in me and that I can also be really genuine and honest with you when needing to be, and that can be difficult sometimes. So if you have any questions or concerns, please feel free to reach out to me. I would be happy to answer any of those things. And if you are interested in reaching out, I'm really looking forward to getting to meet you.